Country Director, UNH, Ms. Renata Ram, senior health officials that are gathered today, NGOs and CSOs and our media partners, ladies and gentlemen. Before I go on, I just want to pay tribute to those who have suffered from the disease, those who have passed on, and those who are boldly carrying on and advocating so that we can be able to prevent the onslaught of this disease on our nation and on our people. Also want to pay tribute to all the health professionals and stakeholders, NGOs that come together and work together in health. Thank you for inviting me to the World AIDS Day celebration, which is globally on this day, on the 1st of December. And as we all know, this is the 30th anniversary of the first World AIDS Day. 30 years of activism and solidarity under the World AIDS Day. It was in 1981 when the world first diagnosed its first case. And in 1989 was when Fiji diagnosed its first case. Now really, when we have diseases in the world that begin to come, there's often a lag phase, as you know, and later we begin to find it locally. And it's no different to what we found with AIDS and HIV in Fiji. But we celebrate 30 years of success in reducing new HIV infections, reducing AIDS-related deaths, and preventing mother-to-child transmission. We have reduced stigma and discrimination, increasing diagnosis and treatment, and giving a positive note to life. And having said that, I want us to remember that the provisions of the Constitution of 2013 and the Bill of Rights with the right to equality means that no one can be marginalized or discriminated based on their disease. And so, just reaffirming what I've said earlier. While Fiji celebrates World AIDS Day for various reasons, as I've said earlier, we remember those who have succumbed to AIDS disease, and many have died because they didn't have access to the HIV services that we now have, or due to stigma and discrimination. We acknowledge those who boldly carry on living with HIV, including their families and communities. And Fiji from the beginning had significant amounts of stigma and discrimination. And I remember as a young doctor in the hospital, it was very profound, the stigma and discrimination around it. But obviously with a lot of advocacy and a lot of media statements that began to show that this was wrong, this stigma and discrimination has gone away. And we made significant progress as a nation since we first had our first case in 1989. And one great example is our first diagnosed case in 1989 is still alive, living life to the fullest. The Fijian government has made commitments to the following. One is ensuring that all HIV positive patients have free medicines for HIV since 2004. Number two, HIV counseling and testing services are free for all Fijians. And three, Fiji has endorsed and implemented the Fiji HIV Decree in 2011, which protects the rights of persons infected or affected by HIV, including the right of the unborn child. And four, moving towards testing and treatment of HIV cases, we look towards prolonging life and giving them an opportunity to enjoy life positively. And as you all know, our former president, His Excellency, Dr. Pelin Aliatikau, has been and continues to be an advocate for HIV in Fiji and the Asia-Pacific region. While the list can go on, an important priority has been to ensure linkage of national programs to the global agenda. And the Fijian government, through the Ministry of Health and Medical Services, is committed to strengthen and implement the global health strategies for HIV/AIDS, viral hepatitis, and sexually transmitted disease, and the East Track strategy of 1990, as Ms. Renata Rami talked about, of UNH, which is reflected in the Ministry's HIV and STI strategic plan for 2016 to 2020. Apart from the government's commitment to HIV, we have in Fiji our partners who significantly contribute to our efforts in curbing STIs and HIVs, and those have been highlighted by Ms. Renata Ram, WHO, UNICEF, UNDP, UNAIDS, SPC, UNFPA, and other government and non-governmental organizations, civil society, faith-based organizations, and Fiji network of positive people. This support includes, but is not limited to, funding, technical, but also preventative program implementation at the community level. Fiji, as of July 2018, has recorded a cumulative statistics of 919 cases, with more than 80 cases diagnosed per year since 2015. This increase is a result of decentralized services that Fiji initiated in 2015, where all subdivision hospitals starting to confirm their own cases rather than sending it to one central point in Suva. HIV in Fiji affects a varied range of people, though close to 70 to 80% are young people who fall within the age group of 20 to 39 years of age. To address the rising number of HIV cases in Fiji, the Ministry of Health and Medical Services believes and advocates on the global strategy of 90-90-90, where we want to test 90% of our population, and we want to ensure that 90% of them are on treatment, those who are positive, and we're hoping to see that 90% of those who are on treatment are virally suppressed. While testing becomes the gateway to treatment, an effective treatment is a great HIV prevention tool. It saves lives and prevents HIV transmission. The theme, Know Your Status, highlights a key instrument to addressing HIV in Fiji. Today, we also launched the Test 4K Fiji, FJ, where we intend to test 4,000 youths who have been seen to be the most vulnerable of the population for HIV. The benefits are, we're testing to save lives, we're knowing earlier and starting earlier, we're hoping to stay HIV-free, we're looking after loved ones, stopping transmission to babies, we're claiming the right to health, and staying alive and well. Ladies and gentlemen, HIV is not a death sentence. Treatment has been a game changer, and people now live longer. I live today challenging all Fijians not to do business as usual, to move out of your comfort zones and step up in your overall response to HIV in Fiji. We need to step up, and step out to make the difference the country needs. Let me end by quoting the Executive Director of UNAIDS, Michelle Sidibe, in which I quote, she says, "The fight against HIV and AIDS is not over. We have miles to go. 9.5 million men and women and children are not accessing treatment. They are not capable of protecting themselves. Their families and partners, they do not know their status. Testing is so important because when you are tested positive, you can have access to treatment. You can protect yourselves, your partner, and your families. If you are negative, you can also have access to preventative measures, knowledge and skills, which will keep you negative. Live life positively. Know your HIV status." Ladies and gentlemen, thank you very much for the opportunity. Thank you for taking time out from your busy Saturday to come and celebrate with us, and also support those who are working hard against this disease, and also support those who may have lost loved ones, and those who are carrying on. And thank you that we can be able to come together. Once again, Navaleu, and God bless you.
Thank you very much.
Ladies and gentlemen, please a round of applause for the Honourable Minister who has just launched this